Hi everyone, welcome back to Beyond Your Knowledge. So today we are going to be reviewing visual pathway from above. But before we continue, I would like to share with you Psalm 37, 27, 29, and says that turn away from evil and do good, so shall you dwell forever. For the Lord loves justice. He will not forsake his saints. They are preserved forever. But the children of the wicked shall be cut off. The righteous shall inherit the land and dwell upon it forever. Amen. Well, so with that in mind, I think that we can move on. Okay, that was Psalm 37, 27, 29. Okay. Let's see how we're going to see the visual pathway from above. Okay, so it is in this way that we're going to do it. We are going to draw okay, so first, this is our brain from above. Let's just do a big kind oval here. Okay, let's see. Yeah, we're not going to do very big because we really don't have room. Okay. Yeah, we'll open better a new slide that we can have more room. Okay. Let's see. So this is oval. Okay, something like this is a kind of not very nice. Let's just try one more time. Okay, well, yeah, this is still okay. So what we can do here, so let's just not do that big because we really need to work with it. So this is your brain from above. Okay, remember that your brain so some areas looks like this. Okay, and then here because we need to draw the hemisphere, the left hemisphere, the right hemisphere. Okay, so you can go just like this here. Okay, so this is the left side. Here is the left side and this is the right side. Okay, now so we have here two balls. Okay, let's just see this here, which is going to represent the eye. Okay, so the entering of the light. Okay, so we have that one there. Okay, this is one eye on the left side, then the other eye on the right side. Got it? So now you have two eyes. Okay, so let's see what else we can see. So now we are going to have here this kind of similar to a ball or something. It's not a ball exactly, but okay, let's see, it should be more here. Okay, so and then we're going to split this, split it, and when we're going to paint one side, this is going to be green. So this is going to be green here on the left side, the external lateral. It's going to be green. Okay, so then we're going to paint the other side blue, dark blue, so now dark blue here, the middle side, okay, so dark blue there. Then on the right side, the dark blue is going to be instead of the medial part, it's going to be in the There we go, on the lateral. Got it? And then we come back again to green. But now green, the right side is going to be medial. Got it? Okay, so there we go. Let's see. Now we can continue. We have this, and then what else we can do? We should do here. Well, we need to focus in this. So enter the. Now we will see how the lights go through. Okay, so this one, let's just do it. Just give it 3. Okay, let's just start with the green. So the green here. Enter the ray here, the green, and then go to the opposite side, go like this. Okay, go there. Okay, and then from there this green light is going to hit here. Got it? And then it's going to come to the optic nerve, going to cross here on the midline in the optic chiasm. And then it's going to continue to the right side, come from the lateral left to the right side, and then here is going to have this, because here is going to join the other this one, this green hit here. Okay, and then it's going to join and come out here until here, and then come and start to join here. Okay, and then do like this, and decide to come here to this area. Got it? And then continue. Okay, so there's several of those. Got it? Okay. So yeah, this is yeah. So now some of those are totally fine, just like this. Okay. Now let's just, this is the green. Let's just the other. So remember that when they enter into the opposite. So this one is in the middle, is going to now enter to the lateral. And this blue one, so which is lateral, going to, oops, so shooting the big. Yeah, it should be 1 probably. So come here and and then it's going to come to the lateral side here. And then come all go through, and then it's going to come here and then do this, and then from there it's going to radiate, which is called, okay, so let's just name a few things here. So this area here, all this, the green and here is the optic nerve. Okay, then we have here in this area here in the middle, so it's going to be the optic chiasm. Optic chiasm. Then this one here, before the radiation, this one here, it is the optic tract. Okay, so now this group here, the one that is more external, this one here, is called Major's loop. Okay, yeah, and then we have lateral. This, do you remember this one here? This is the lateral, which is this one here too. Lateral geniculate nucleus. Okay, and then we have one more, which is going to be the dorsal optic radiation. The dorsal optic radiation is going to be more like to the midline. So if you see, yeah, so it should be more here. Oh, sorry, I'm erasing. Okay, so it should be around here. Let's just draw it. So we draw here this one. Now we are drawing the major loop on the other side. Okay, major loop that come from the major loop that come from where? From the optic. From the optic, now from the lateral geniculate nucleus. Okay, so this is the major loop, and then the other that is more to the midline is the dorsal optic radiation. I'm going to do now. So this is the dorsal. So this one here, this is the dorsal optic radiation. Okay, so yeah, so basically this is the visual pathway from above. Okay, so let's just put a name here in this corner. Yeah, so let's see. Yeah, so basically this is what is important that we remember this, because depend of the area that we have the lesion, so that means that the patient field is going to be affected. So if you have a lesion in the optic chiasm, it's going to present with one way. If you have a lesion in the optic tract or optic nerve, yeah, you're going to present one way, another way. So let's just assume that you have a lesion in the optic tract. So the optic tract is just right here. So that means that then you follow where comes the optic tract. So you're following the optic tract, the tract, so come all this way, and then it's going to project where? So you're going to project here. So that means that it is in the nasal, because remember that if you have your face, okay, so this is your face here, okay, and then you have here your nasal, which is more to the midline, okay, so that means that any lesion that is here, so let's just imagine that this is your let's just assume that this is your nose, okay, so nasal, and any lesion that is beside to that, so it's going to be nasal, which is also into the midline, okay, or then it's going to be lateral, which is going to be right here, okay, so lateral, and those are nasal or medial. Got it? And then, well, so if the patient that has an optic tract on the left side, for example, so the patient is going to present with a lesion, then we just need to put a name, because, for example, contralateral homonymous hemianopia. And since now I would like to explain so different visual field defects and the lesion, and to see this, we're going to open a new slide here. And then we're going to do like a table, okay? So we're going to be seeing the visual field defect. We're going to see the location of the lesion and we're going to see then the possible causes. Okay, so with that in mind, we can move on. And yeah, so let's just have more room here. Yeah, so line here, and cool. Okay, so the first one that we're going to see is a visual field defect, and this first one we're going to put a name now. It is the monocular scotoma. Okay, so monocular scotoma, how monocular scotoma present? Well, let's just assume that this is one eye, this is the other eye. So monocular scotoma is something like this. This is monocular scotoma. And now, what is the location of the lesion? Monocular scotoma, that is a partial lesion in the retina, optic disc, and optic nerve. Okay, so partial lesion in the retina, optic disc, and optic nerve. So if you remember, for example, the optic nerve, so we can see right here, this one. Okay, so which is here. So this is the optic nerve. So can cause this monocular scotoma, a lesion in the optic nerve. Okay, yeah, so we can see right there. Okay, let's see what else we can mention here. Actually, monocular is a wrong spell. Let me just fix it. It's no monocular, it's monocular scotoma. There we go. So now the possible causes of this one is a macular degeneration, and or also optic neuritis. Okay, yeah, so basically this is for monocular scotoma. The other lesion that we can see is a right anopia. So right anopia, so imagine like this. Okay, so but yeah, so in this right anopia, so what's going on here? So basically the patient has all this area is going to be black. Okay, yeah, so all this is going to be basically blind, all this. Okay, so there is no room. All this is going to be, and this is called right anopia. So in right anopia, what is the location of the lesion? Well, you need to think in right optic nerve. Right optic nerve. So and then we can see here the optic nerve. Okay, so again, this is the optic nerve is here, but it's going to be on the right side. So the right optic nerve. Okay, so the right optic nerve is the one that is going to have this lesion. Actually, that I just noted that I didn't draw it. Yeah, so because if the lights come from here, then just follow the lines, and let's see, oops, sorry, sit here, okay, and then it's going to go here, oops, sorry, that's not good, then come here, whoop, there we go, and then go through, go to optic chiasm, and then cross here in the optic chiasm. And where do you think it's going to join? It's going to join here in this, that was the lateral geniculate nucleus, okay? Yeah. Okay, yes. So yeah, if you have a lesion on the optic nerve, in the right optic nerve, so you get right anopia, so that means that your right side is going to be totally blind, and because that is a lesion on the right optic nerve, okay, cool. So what are the possible causes of this one? The possible causes of this right optic nerve is a retinal artery or retinal vein occlusion. So it is a what? It is a retinal artery or central retinal vein occlusion. So that means that it's going to be an occlusion of the, just to do better, occlusion of retinal artery, central retinal vein. Got it? Yeah, so an occlusion any of those, so the patient can get right anopia. Okay, so now let's just open a new slide that we can continue with the others, with the other lesions, okay? Yeah, so let's just see, there we go. I will put this in one more slide, because probably we'll be introducing 2 or 3. We can already have it. Okay, so next lesion, it is a bitemporal hemianopia. Bitemporal So this is bitemporal hemianopia. Okay, so how does bitemporal hemianopia mean? So remember, bitemporal, so that means that it is in two places. So bi comes like for two, okay? And if it's bitemporal hemianopia, you think it's going to be more to the midline or to the lateral. So what is the temp? Yeah, so the temp, it is, okay, so yeah, the reg, so bitemporal is going to be more here. Okay, yeah, so it's a little bit big. Okay, yeah, this is bitemporal. Got it. There we go. So this is the bitemporal. This is how bitemporal hemianopia looks like. And what else we can say about bitemporal? Well, we need to know the location. We need to know the possible causes. So, but the lesion in this place is going to be in the optic chiasm. Where? Optic chiasm. So, and if you remember, we can go here to the picture. Optic chiasm is right here. Do you see? This is the optic chiasm, which is in the middle. So basically it's the place that everything become the cross of fibers and everything. So on the optic chiasm you can get bitemporal hemianopia because that is a lesion. But what can cause this? Well, there are different causes. For example, if the patient has any tumor of the pituitary gland, because there is the tumor of the pituitary gland. What else do you think that can cause this? Any craniopharyngioma, which is another mass, a tumor, pharyngioma. Also an aneurysm of anterior the communicating artery, or also aneurysm of the anterior communicating artery. Got it? There you go. So this is a bitemporal hemianopia, a lesion in the optic chiasm. But there is another one that we're going to be talking right now, and this one is called right nasal hemianopia. So that's means the right nasal hemianopia. So the left side is going to be totally fine. So you have your left side here, totally okay. But then when we go to the right eye, so it's going to be blind in the medial line or the lateral line. Which one do you think? So it's going to be blind in the medial line because it's called right nasal hemianopia. So that means that it is in the nasal area. So this is right nasal hemianopia. So, and then how this looks like, so we can just, this nasal is going to be just like here, okay? Yeah, so it's going to be blind on all this there. This is the right nasal hemianopia. So what are the causes of the right nasal hemianopia? The lesions. So what do you think that the lesion is going to be? Well, it's going to be in the right side because it's in it is perichiasmal lesion. So that means it's around of the chiasm. Perichiasmal lesion. Okay, so if we go here to do you see the chiasm again here? It's around this chiasm. The lesion is going to be around here, okay? So around there is going to be the lesion. Got it? So that was the right perichiasmal lesion, okay? Causing right nasal hemianopia. And what are the possible causes? So, well, could be calcification, could be or aneurysm of the internal carotid artery. So that's mean anything that decrease the blood supply to this area. So calcification or aneurysm of the internal carotid artery. Got it? So now do we have more causes? Well, could be discalcification or reason of the internal carotid artery impinging or on uncrossed and lateral retinal fibers. Okay, so this can happen is yeah, so impinging, so on uncrossed and lateral retinal fibers. Okay, so yeah, so basically it's all about right nasal hemianopia. Let's just see if we have more lesions here. Let's just talk a few more. Okay, so let's see. So the next one that we're going to see is called the left homonymous hemianopia. Do you remember we saw bitemporal hemianopia, but now we're going to see left homonymous hemianopia. Left how left homonymous hemianopia looks like. Okay, we need to work with that. Yeah, so if the left, so that means that is going to be blind on the left side. Okay, so in the left side is going to be blind here. Okay, and it's going to be blind here. Got it? Left homonymous hemianopia. So what is the lesion? The left homonymous hemianopia is going to be in the right optic tract. The right optic tract or on the optic radiation. Just back to the picture. Okay, so the lesions for left homonymous hemianopia, the lesion is in the right optic tract. So we go to the right side. We are here in the right side, and now we look for the optic tract. So the optic tract, so if you see, is this one here. So this one there. So there is a lesion. The right optic tract. So lesion there can cause this left homonymous hemianopia, or in the optic radiation, which is the optic radiation is going to be this one here. Okay, so yeah, so lesion over there, so that can cause this left homonymous hemianopia. Okay, yeah, so now let's just move on. Yeah, so okay, let's just continue. So what are the possible causes of the left homonymous hemianopia? Well, we have a few. So because do you remember that the lesion can be in the optic tract or on the optic radiation? Let's just talk about if the lesion is in the lesion is in the optic tract. What do you think? So if the lesion is in the optic tract, so what are the causes? So that could be an occlusion of the anterior choroidal artery. Occlusion of the anterior occlusion of the anterior choroidal. So choroidal, yeah, there we go. Artery. Okay. So if there is a lesions in the occlusion of the anterior choroidal artery, should be good idea if we can see what is the anterior choroidal artery. So let's just see a picture here, and this artery, this one that you can see here, this is the internal carotid artery, but this internal carotid artery gives you a branch, and this branch that we can see right here is the anterior choroidal artery, and a lesion of this one can cause optic tract, so lack of fluid, so and then the patient can develop the left homonymous hemianopia. Okay, yeah, got it. And when we remember also there were another, the right nasal hemianopia, so which is this one here, the right nasal hemianopia, that one, you remember that has calcification or aneurysm of the internal carotid artery. Yeah, so yeah, so we can see the internal carotid artery here, which I already marked before, so which is the one that gives you the branch from the anterior carotid artery. So this is the internal carotid artery there. Okay, so lesion of this one can cause the right nasal hemianopia. Right nasal hemianopia. Okay, so let me just put a red. We know that is a lesion. Okay, let's show this one. Got it. The other that we saw was the right anopia. Let's just see anatomically. So the right anopia is this one here. Okay, yeah, so this right I mean, sorry, this is not, sorry, I apologize, it's right anopia. Yeah, this one. Yeah, this is the right anopia. So when the lesions or the occlusion, I mean the lesion is in the right optic nerve, but the cause is the retinal artery or central retinal vein. So let's just see a picture of that. Okay, so here we can see the retinal, central retinal artery and vein just here. Okay, so that right there, and then lesion of that one can cause a right, so a lesion of this can cause a right anopia. Got it? Yeah, so but we've been talking about all those things. I think that could be a good idea if we just see a picture of the eye, so how the eyes work, or the parts of the eye. So here it is, the eye. Yeah, let's just move a little bit this here. Okay, yeah, so that's the eye, and let's just do the eye right now. Yeah, so remember that was here the lesion. Okay, yeah, now this is the lesion. This is the eye, the anatomy of the eye. So what we can learn about the anatomy of the eye. So the eye has, for example, your cornea. Okay, you have your iris here, and you have your pupil, which is opening the iris, and then we have the lens here, then we have the suspensory ligament of the lens in each corner, then we have the posterior chamber, we have the auxiliary body and muscle for movement, then we have the retina is here, and we have the choroid, so which is posterior to the retina, which is this one, and posterior to the choroid we have the sclera, which is this one. And also all those, the retina basically is it is inside of the ball, and the first layer of the ball you have your vitreous body, which is all this here. Okay, it's more than that. And then the macula, which is here in the posterior part, and then we have the optic nerve with the blood vessels, and the blood vessels has, for example, those blood vessels has, for example, the central retinal artery and vein, and the lesion of that can cause right anopia. Got it? Yes. So basically this is our eye. So let's just continue. So the last one that we saw, let's just continue with the visual field defect. So the last one that we saw was the left homonymous hemianopia, but we mentioned that there are two possible causes, and we saw already the optic tract. The other cause, it is going to be the optic radiation. Okay, so in the optic radiation, if we saw the drawing that we did before, so the optic radiation is here. You see this here? Yeah, this is the optic radiation. Okay, here, and also it's going to be right here. Okay, this is the optic radiation, and yeah, so this optic radiation can cause also this left homonymous hemianopia. And This optic radiation, it is due to occlusion. So occlusion of a middle cerebral artery, okay, of a middle cerebral artery branch, or a lesion involving what? Posterior limb of the internal capsule, involving the posterior limb of internal capsule. Okay, so has a lesion on the middle cerebral artery. Let's see. So has a occlusion of middle cerebral artery, and basically, if you see, the internal carotid artery can cause the right nasal hemianopia, but in the middle cerebral artery is right here. Okay, so lesion of this middle cerebral artery can cause your left homonymous hemianopia by optic radiation. Homonymous hemianopia, but by the optic radiation. Got it? Yeah, so this left homonymous hemianopia have this lesion that we mentioned here, with the optic radiation, which is going to be the middle cerebral artery is going to be affected. Also, we saw the if it's by the optic tract, is occlusion of the choroidal artery, which was this one here. Okay, the one I just erased. Let me just mark again. Yeah, but this homonymous hemianopia has just one area for the optic tract and two for the optic radiation. The optic radiation, we just mentioned one, which is the middle cerebral artery branch, and then the other lesion is the involve the posterior limb of the internal capsule. Okay, so the posterior limb, so I just write it here before, of the internal capsule. So but would be a good idea if we can see a picture of that. So let's see the picture. Yeah, so basically this is this one that is here in red and in blue. So those are the internal capsule. Okay, all these that are those colors. But the lesion that happened in the optic radiation, when it's due to the posterior limb of the internal capsule, which is this one here. Okay, so this one there. And yeah, so basically is that this is another superior view of your brain. Yeah, superior view is also known as above view. Okay, I think that this is all about the left homonymous hemianopia. Let's just see. We're going to open a new slide, so we finish the left homonymous hemianopia. So we don't have too much room there, so let's just open a new slide. Yeah, so we have one here. Yeah, so the next one that we're going to see, it is the left homonymous. Now we continue with the left homonymous, but yeah, so the left homonymous superior. Okay, so superior quadrantanopia. So with the words that we are saying, so quadrant, like quadrant, cuadro, for me just like sounds like four, and for those that speak Spanish, so cuatro, yeah, something like this, quadrantanopia, cuatro, okay, four. Okay, but let's just draw how this is going to look like in the in this oops, sorry, I think that this is the wrong one. There we go. Yeah, so This patient is not blind yet. But if we split this in 4, so we're going to have one here. It's going to be just like this, okay? And then one here, okay? So, and now, there we go. Yeah, so this is the left homonymous quadrant and Opa. Okay? This left homonymous quadrant and Opa, also known as a pie in the sky. Pie in the sky. Now, what is the location of this one? So, if you see, it's going to be in the right temporal lobe. Okay, so that means this opposite. So, the lesion is in the right temporal lobe. Exactly in the major loop. Major loop. Okay. Yeah. So here it is. Major loop. So I think that we can major loop. So we can go to the picture that we draw at the beginning. Yeah. Major loop should be right here. Do you see major loops? Yeah. So in this area here, yeah, so the lesion there can cause this left homonymous superior quadrant and Opa. Okay, this is the major loop, is just right there. Okay, now let me see. So we can come back to our slide. There we go. So major loop. Now, what is the possible causes of this? So a lesion or stroke of what? Involving the temporal lobe. Got it? There we go. Yeah, so basically is that. Yeah, so, and I think I can. So here is the picture of the temporal lobe. Okay, so there we go. So this is the one is the temporal lobe, the pink. Okay, so that was the left homonymous superior quadrant and Opa. But if we have one superior quadrant and Opa, we also has one inferior quadrant and Opa. So let's just talk about that one now. And let's just here. Well, well, you say no, this is not. It's not the same. It's the same. Well, you're right. This is the same as the superior quadrant and Opa. Well. So what is the difference? So basically, it's the location. So that means the mid superior is going to be inferior quadrant and Opa. Instead of being pie in the sky, it's going to be pie on the floor. Okay, so now you have pie on the floor. So that means if it's pie on the floor, so how do you think that is going to look like here in the field? So this one is not, because this is superior, so this is going away. Okay, so now how do you think it's going to look like? Well, just like on the floor. So just a pie here and a pie on the floor there. Okay, so now we can color. Okay, so just like that. Yeah, basically is that here. Yeah, so this is the left homonymous inferior quadrant and Opa, left homonymous inferior quadrant and Opa, or pie in the pie on the floor, not in the on the floor. Yup, what's going on? Just pie on the floor. Okay, we know. Now, yeah. So where is the lesion of this? The location is going to be in the right parietal lobe. So dorsal optic radiation. dorsal optic radiation. Okay, so we can go to the one that we drew before at the beginning. There we go. So the dorsal optic radiation is right here. Okay, so a lesion over there in this dorsal optic radiation can cause your left homonymous inferior quadrant and Opa pie on the floor. Okay, so that now you know. Now we know lesions there. Okay, lesions there. Okay, cool. So now let's just move on, come back again to our table. And so that's happening in the right temporal lobe in the dorsal optic radiation. Oh, I'm sorry, in the not temporal, it's a parietal lobe. Probably it should be a good idea. Let's just watch a video of, a picture of the parietal lobe. Okay, so there we go. Yeah, this is a parietal lobe here. Okay, so yeah, this is your parietal lobe right there. You got it? Yeah, so lesion over there, so can cause this left homonymous left homonymous inferior quadrant and Opa, which is pie on the floor. Okay, so pie on the floor. And what are the possible causes of this? So there is a lesion or a stroke involving, what do you think is going to be involving? We already gave the answer. So your parietal lobe. Got it? Your parietal lobe. Cool. So this means that when you think in those that are pie in the sky or pie on the floor, when you think in those quadrant and Opa, you need to think in two lobes. If it's the inferior, which is the inferior quadrant and Opa, you need to think in your parietal lobe. And when you think in your superior quadrant and Opa, you need to think in your temporal lobe. Okay, now there is one more lesion or one more visual field defect that we need to talk about, and we're going to start right now. Okay, so this one is called left homonymous. We have plenty of those. Left homonymous hemianopia. Okay, hemianopia. That means in the half with what? With macular sparing. So how this is going to look like in the visual field? So imagine that this. Okay. Yeah. Imagine that this is your visual field. Okay, that should be more. Okay, so this is your visual field. Okay, yeah, so and then how we're going to see this, so because just makes sense. So if it's left homonymous hemianopia with the macular sparing, so that means that's going to look like straight here, straight, macular sparing, straight, and then the other side the same. But if, because on the left side it's always going to be on the left, so go here, and then we just got it. Then here we do the same too. Got it. So left homonymous hemianopia. Okay. Okay, this is how it looks like. So what is the lesion? So the lesion is going to be in the right primary visual. Okay, let's just write primary visual cortex. Okay, this is occipital lobe. Whoa, so it looks like that we're going to be occipital lobe. So we're going to be running all the lobes. I can see it. Not all the lobes, but yeah. So now we can see a picture of the two. So here is the occipital lobe picture. It's just right here. Okay, So they're just right there. So that is going to be a right primary visual cortex occipital lobe lesion, which is going to cause the left homonymous hemianopia with the macular sparing. And what are the possible causes of this one? Is going to be occlusion of the posterior cerebral artery. So, and then macula is spare due to collateral blood from where do you think that come from? Blood from the middle cerebral artery. So that's mean that the lesion cerebral artery. So that means that this patient has a lesion in the posterior cerebral artery, okay? But it's going to the macular spare because the patient has a supply through the middle cerebral artery. So now we can go here to the arteries. Yeah. So basically here, do you see the posterior cerebral artery? I will show you this one, a posterior cerebral artery. This one is the one that is going to be occluded, and then the patient is going to get left homonymous hemianopia with a macular sparing. So lesion of this one can cause left homonymous hemianopia with a macular sparing. So why with the macular sparing? Because the middle cerebral artery is going to supply that one, okay? And probably you are saying, but what is the middle cerebral artery? Well, the middle cerebral artery just right here. I will show you again. I'm going to put in a I'm going to paint it in green because yeah, this one, okay? Yeah, and then use happy face here, happy face that we can go macula is spare because middle cerebral artery supply it. Got it? Yeah. So excuse me. But this middle cerebral artery, remember that occlusion of that one can cause left homonymous hemianopia, which is due to in the optic radiation. Okay. Okay. So now I think now we can come back here to occipital lobe. Yep. So just to close, so reviewing, so remember this is the temporal lobe, okay? I have the temporal lobe here, parietal lobe, occipital lobe. All those depend on the area that is going to be affected, can cause any visual field defect. Well, this is all about visual field defect, and from this now in this video, so then we can watch the pupillary light reflex. I'm going to do a separate video. So thank you so much. God bless, and hopefully in Jesus' name we can continue learning, and we can do all things who God strengthen us. Happy faces, study with us with the joy in Jesus. God bless.